Allowing gay men to donate blood. There is a shortage in blood donations. Could the gay man help alleviate this problem? The American Red Cross states if a blood donor gives 3 times a year, blood shortages would be a rare event. I've always been an advocate for donating blood for as far back as I can remember. I've read many articles in journals and have researched the internet regarding gays and the possibilities with them donating blood. From the stigma of disease transmission to closing the year-long wait, donating blood will always be in a shortage unless you change the rules around it. I will discuss 3 topics that play a major role with blood donation, discrimination, blood shortage, blood testing, and tracking. According to the FDA in 1985, the FDA placed a ban on any man that has had sex with another man even once since 1977 from donating blood. This outcome was due to the politics around it and not the science behind it. The thought was if you are gay, then you must have AIDS or HIV. As Dr. Alex Matthew has remarked, this disease is not one of races or nationalities, it is one of risky behavior. Currently, the FDA has placed a 1-year celibacy rule that allows gay men to donate blood. They hope to change this to a 5-year celibacy rule. This is due to the agency being conservative and worried about blood bank employees who will make an error and therefore giving infected blood a way to slip through the cracks. In the 1980s, the FDA discriminated against Haitian Americans after the 1970s. They banned all Haitian Americans due to the high risk that Haitians presented with. The ban was met with opposition and eventually removed in the 1990s. Martucci J. discussed this in negotiating exclusion. If we allow individuals who classify themselves as straight, who may or may not be having protected sex, donate blood, then why are we not allowing gay men who use protection and are being tested on a regular basis donate blood? This does not make any sense and falls back on the stigma and discrimination rather than science behind the matter. I believe it is safe to say that most gay men would be willing to donate if the opportunity was available. If we allow gay men to donate blood, they could be the 1% that could help resolve the shortage issues that we currently have. The American Red Cross supplies half of the nation's blood supply. They also stress the constant need for blood and platelets. While 38% of the population in the U.S. is allowed to donate at any given time, only 10% donate on a regular basis. In a 2010 study by Williams Institute at UCLA School of Law, the estimated number of banned donors was calculated to be around 2.6 million. If the ban were lifted and allowed gays to donate blood, this would result in more donors and pints of blood. If we look how important blood donations are and review the science behind it, we can see that there is no need to restrict donors due to sexual preference. Blood Center of Pacific believes a question should be posed for the FDA and the scientific community. Having the knowledge that is based on testing evidence and procedures that each unit of blood goes through, BCP feels that it is not necessary to ban gay men from donating blood. Since the 80s, blood testing and detection of AIDS and HIV has improved tremendously. With the ever-growing technologies and upgrades that are available, the blood banks have the capabilities of testing the blood for various diseases and infections. Most blood banks generally test for 13 different things. Each unit of blood is required to be tested before they are sent to the hospitals and administered to individuals. Out of the 13 different tests, 11 of these are for infectious diseases. Not only is the blood tested for HIV and AIDS, it is also tested for diseases such as Hep B, Hep C, syphilis, the Zika virus, West Nile, and others. While donating with the American Red Cross, at the time, the donor is given blood samples and collected and sent to one of the American Red Cross's labs. During this time, each unit of blood is tested for multiple diseases. If the blood results return with positive outcomes, the blood is discarded and the individual is notified. By FDA regulations, the blood banks are required to maintain a list of donors not suitable for donating blood. Not only is each unit tested, they are also tracked. Each unit of blood has a machine-readable barcode for identification. This purpose is to reduce transfusion errors and increase patient safety. If there happens to be an issue once the blood has been transfused, there is a method in finding out who it came from to do follow-up testing and to see if it even came from the donor or not. Not only is each unit of blood tested for multiple diseases, each facility is held to certain standards and regulations that are inspected twice a year. If the facility is labeled a problem, they are inspected more frequently to provide safe and suitable donor blood. The standards are comparable to pharmaceutical manufacturers. We need to educate on the process and the testing that the FDA has required for each unit of blood to go through. From the stigma of disease transmission to the closing year-long wait, donating blood will always be in a shortage unless you change the rules that are involved. The only way to overcome this battle is to first stop the discrimination, look at the shortage that we currently have, and lastly, rely on test results. If you were in a horrific accident and sustained multiple life-threatening injuries that required surgery and multiple blood transfusions, would you stop and ask, was that blood from a gay man, or would you sign the consent form without hesitation? Thank you.